Today, I'm really pleased to be introducing Dr. Robin Urquhart, who will be speaking about the Pan-Canadian Framework for Cancer Survivorship Research that she led. So Robin is an assistant professor and Ramia scientist in the Department of Surgery at Dalhousie University, with cross appointments in the Department of Community Health and Epidemiology and Division of Medical Education. She is also a senior scientist with the Beatrice Hunter Cancer Research Institute and an affiliate scientist at the Nova Scotia Health Authority. She has research programs in cancer survivorship, palliative and end-of-life care, and implementation science. Her research has informed provincial and national initiatives related to the quality of cancer and palliative care. Robin, I'm going to hand off to you, and then we'll, after you present, we'll open up the floor for discussion from people who've connected remotely across Canada and everyone in the room.
Okay, perfect. Can you hear me okay?
Yes, I can hear, we can hear you very well.
Okay, perfect. Okay. So thank you very much. I will speak today about the Pan-Canadian Framework for Cancer Survivorship Research. And I would like to thank the CCSRC for inviting me to talk about this. So what I'm going to talk about today, a little bit of background to the framework and how it came about, and the organization that created this framework and is taking it forward. The approach that we took, so I will go through sort of the process that we took to develop this framework, and that work had happened throughout last year in 2016. And then I'm going to talk about the resulting framework. So I'm going to try and stay at a fairly high level and talk about the 4 recommendations that came out of that work, or that's in the framework, and specific priority areas. So the Canadian Cancer Research Alliance are really, the developers, or the coalition that is brought this framework to the forefront. For those of you that don't know, the CCRA is a coalition of cancer research funding organizations and provincial cancer agencies from across Canada. So those are sort of federal and provincial research funding organizations, and also charities. And those organizations, member organizations, are working together to enhance collaboration and to be strategic and to have strategic organization around cancer research. The membership of CCRA has grown from 21 to 34 members since its inception in 2003 and its formalization in 2005. And the executive office is supported by the Canadian Partnership Against Cancer. So I'm sure many folks who are listening here know about the partnership. And the partnership's commitment to enhancing the cancer research environment in Canada, really a lot of it is through its support of the CCRA and the coalition's role in coordinating, again, the cancer research funding system. So the purpose of the CCRA, just again to give you a bit of background, is really to foster the development of partnerships. It's to promote the development of national cancer research priorities and strategies. It does report on, so many of you may have seen some of their reports that they have put out fairly sort of regularly around the nature and impact of the investment in cancer research funding in Canada. And to work together, the coalition, the member organizations work together to really achieve the overarching goals of effective and timely cancer control. Here are all of the member organizations of the network, or of the coalition, sorry. So I put this up there, but you can see that there are provincial, federal funding agencies, there are charitable organizations that fund research, cancer research, and so on. Oh, that went by. So the framework really came out of this second CCRA strategy, and it's called Target 2020, a strategy for collaborative action. So CCRA had a first strategy, and they had a number of action sort of items. I think there's 24 actions in that strategy, and a number of them were around cancer survivorship. But those have been completed now, and this is sort of their 2015 to 2020 strategy. And this sort of national sort of collaborative strategy really just lays out a number of priorities to maximize the impact of shared targeted investment. And it supplements, and I'd say complements, the strategies of the individual member organizations. So this strategy focused on 5 thematic goals, 5 thematic areas, and they are here. And the cancer survivorship research framework really comes out of the patient experience thematic goal. So the first strategy, so each thematic goal is a number, if you've seen the document, has a number of strategies and then tactics to address those strategies. But the very first strategy of the patient experience goal is to assess survivorship research in Canada and prepare a survivorship research framework that proposes actions to address gaps and builds on existing opportunities. And the expected outcome really was a strategic survivorship research framework that would be developed and launched. So I'm going to go right now into really the framework process and I guess tell you what we did. So the process it was a 9-month process last year in 2016, so from about March until early December. And I guess one of the first things that we did was sort of, establish who would be involved and who would do what in the roles and everything. So I put this up. Many people across the country worked very hard on this framework. And so there was a core project team, and that was myself, as well as an excellent small team of people at the Nova Scotia Health Research Foundation. And we worked together on the project team. Then there was a CCRA working group who provided, great leadership actually in this development. And so they consisted of representatives from each of the member organizations, and it was co-led by CPAC and the Alberta Cancer Foundation. And sitting on that working group also, sitting on that working group also were 2 survivors. So there were 15 people on that working group. We had an expert panel. There were 14 people on that expert panel. It consisted of Canadian and international researchers who had sort of extensive experience in survivorship research from across the country. So we wanted expertise, as broadly as we could from across different jurisdictions in the country. Also, there are decision makers on that expert panel who have a role in sort of, a decision-making role in cancer survivorship care and programs. And there was a few representatives with expertise in sort of the health research funding landscape. And then the next group was the advisory group. There were 6 representatives on the advisory group, and this was essentially representatives of community-based cancer organizations who provide, information, services, supports to and advocate for cancer survivors and family-friend caregivers. So that was the group of us, I guess, that worked in a very iterative way to develop this framework. The next thing that we had to do was define what we meant by cancer survivorship before we could actually sort of go out and gain information and consult with people and so on. So I'm putting this up here because I do think it's actually very important to understand in the context of the framework what we mean by a cancer survivor. And so we ended up, along with and consulted with and worked with the 3 different groups that I've just shown you, really to discuss and gain agreement on a definition before we moved forward. So we defined a cancer survivor as a person who has had a cancer diagnosis or has experienced cancer in some way. And I'll say now that this definition is what we started out with, and it didn't change after all of the work that we did, and you'll hear about that in a minute. So in the context of developing the framework and in the resulting framework, this term cancer survivor does include people from the time of diagnosis. It also includes family friend caregivers whose lives have been impacted by the diagnosis. So we recognized, I would say, early on that, family, friend, caregivers, their experience may not be the same as, and they have different experiences, obviously, than persons who are actually diagnosed with the cancer, but they're also profoundly impacted by the diagnosis. The framework also includes people who have metastatic disease, and as you would know, many people now live very long periods with advanced cancer, whether it's on diagnosis or recurrence. However, it doesn't incorporate issues, it doesn't incorporate issues related to a person's end of life. So things like palliative care, end of life decision-making, bereavement, and so on. So I say that I give that definition, and that's the definition that's in the framework. But if you've read the framework, or as you'll see today, you'll notice that the framework largely addresses the post-primary treatment phase of a cancer diagnosis. And that's because as we consulted with people, the folks that we consulted with and so on nearly always sort of describe gaps related to that phase of the journey. But it's also explicit, I would say, in the framework that we need to recognize, the big we need to recognize the fact that what happens before the end of primary treatment will impact the person's experience after treatment. So that is explicit in there. So the process that we went through, we undertook a scoping review, so a review of sort of seminal reports and published research literature. And that was really just to understand, again, it was a scoping review, so to understand the current state of being in terms of cancer survivorship research in Canada and internationally, and whether, and later we went back to that literature to understand whether and how the literature aligned with what we were finding in our consultation. We also undertook surveys and key informant interviews, and so through those processes, through those two sort of mechanisms, we consulted with more than 200 stakeholders across the country. The surveys were given to both professionals and survivors. By professionals, so they're essentially the same questions, but they were adapted for the two different groups. Professionals or researchers, decision makers, and healthcare providers. Again, just to get sort of a breadth of input and understanding on various relevant issues. And then we undertook a number of key informant interviews, again, with professional survivors and a couple of international experts. And that was sort of to gain more in-depth understanding, particularly of what we found from the survey. So we did these interviews after we had the survey results. And questions around, again, defining cancer survivorship and guidance on developing the framework and so on. So there are a number of limitations to our approach. I want to point this out because it wasn't intended to be sort of a robust, rigorous sort of, methodology as though it was a research study. It was really a consultation process that was designed to gather information to inform this work. And so for the survey respondents and the key informant interviews, we did have, people from all across the country. It reflected all the regions in Canada. We had a mix of rural, mid-size, people from rural, mid-size, large centers, and so on. But I will say that in the surveys, in particular for the survivors, the majority, about 3/4 were female that responded, and more than half were between the age of 50 and 69, and so on. So it's not representative of all survivors. Okay, so the other thing that we did do actually was we generated sort of an analysis of investment in survivorship research from 2005 to 2013, and the results, some of those results are in the report or are in the framework itself, and I won't talk about those today unless someone has some questions. And so essentially this was just meant to show it was a very iterative process. We were gaining all of this information and having these consultations and bringing what we were learning back to the CCRA working group, the expert panel, the advisory group, and so on in a very iterative process. So what I'm going to talk about today, I'm not going to talk about the findings from the surveys and the interviews and so on, although those are summarized in the report. I'm really sort of going to focus on the framework itself and the recommendations and the priority areas. The data we did get, however, was related to largely sort of Canadian strengths and opportunities, existing gaps in care, survivorship care and survivorship research, and sort of the necessary elements of a framework and the necessary elements of future research. So out of that, we generated recommendations. We have a number of research domains and cross-cutting themes that each have their own priority areas. And those are based on what we heard and what we found. The one thing I am going to point this out. I did put in sort of one slide, I guess, about what people told us, and it's around Canadian strengths. And I say this because in a number of sort of priority areas and so on and recommendations later on, I refer to this in that it was loud and clear that we need to build on and leverage what we already do well and our current strengths. So there was a number of things that were outlined by people that we spoke to that reflect our strengths here in Canada. The first is that, Canada, we have world-leading researchers who conduct very robust and innovative research in cancer survivorship. And that goes right across the sort of the health research pillars, biomedical, clinical, health services, pop health. And who have advanced methodological expertise. So everything from database linkage, patient-reported outcomes, qualitative data collection and analysis, implementation science, and so on. Another strength, really, was that we have population-based registries, databases, and sort of the associated infrastructure. So these things are already in place. These things are available across Canada. And we need to, we can and should leverage that infrastructure and those registries and so on and build upon them to track survivors' care and outcomes over time. It was also discussed quite a bit that there are many potential opportunities, and we could create a lot of opportunities for trainees and new investigators in this field, I guess, of research. And, for example, mentorship opportunities, right? Again, they could be widely available if we supported them and cultivated them due to what was described as really excellent clinical and research teams that are in place across the country. And finally, it was noted and emphasized by many that within cancer survivorship research in our country, there's really close communication and collaboration amongst researchers, and there's a real willingness to work collaboratively and sort of across disciplines and across professions. So this was seen as a really big strength in our country. Okay, so to the framework. So this is just the front page. I just wanted to put this up to note that it is available. It was launched, or it was sort of published in March 2017, and it is available on the CCRA website. I know this isn't meant for you to be able to see this. I'm going to go through each sort of part in detail, but this is essentially the graphical representation, I guess, of the framework, and it includes. It notes that the framework includes sort of all health research pillars. There are 3 overarching research domains, and I'll go through each of those, and 4 cross-cutting themes, so cross-cutting regardless of the research domain. And at the bottom here, there are 4 recommendations that I'm going to go through each, so you're not expected to see that right now. But what I wanted to really point out, what I would like to point out before I go through all of the recommendations, are that these recommendations are really meant to support and enable coordinated action amongst the CCRA member organizations and other funders and sort of key stakeholders across our country in order to sort of optimize the relevancy and impact of the research that we do. And so it is meant in that way, sort of the primary target audience, I suppose, is CCRA members, other research funders, and sort of key stakeholders. So it's meant to sort of enable them to take coordinated action. So recommendation number 1 is ensure ongoing and meaningful involvement of cancer survivors and family and friend caregivers. So the sub-parts of that, the sub-recommendations would be involve survivors and their family, friend, caregivers in setting research priorities, and in developing relevant and responsive funding calls. So again, this is a recommendation targeted really towards sort of those member organizations and funders. The next is strongly encourage their participation in the research process. And that's everything from the development of sort of research questions to, to the dissemination of findings. So strongly encouraging approaches such as, in Canada, we would call it integrated knowledge translation, perhaps, or for people familiar with sort of the CIHR SPOR, patient-oriented research. Recommendation number 2 is to align funding calls with existing needs and potential for impact. So number 1 would be to invest in research priorities that address the gaps that have been identified by stakeholders in sort of survivorship research and care. And we'll go through, I'm not talking about the gaps today, but the priorities that I talk about are based on gaps. Increase investment in intervention research, and that's particularly interventions aimed at improving survivors' experiences and outcomes, but also at sort of preventing and managing the known late and long-term effects of cancer and its treatment. Invest in research on special populations. So invest in research that addresses the needs and outcomes of special populations, and I'll talk about that more. And then invest in robust implementation science. So I'm talking about the science part of it, not sort of the KT practice or that sort of translating something into policy or practice. It's the science in order to identify and design and test more effective and efficient ways to actually move research into practice and policy. Recommendation number 3 is create opportunities for the translation of research into practice and policy. So this is what I would call the KT practice part of it, I guess, not the science, but we're recommending, the recommendation is that CCRA members and other funders and so on actually create opportunities that allow research translation to happen. So the first there would be actively support collaborative research that really crosses I think jurisdictional and disciplinary boundaries. And this was seen as being, particularly important given that many survivors will have sort of substantial and long-term needs. And I think, and the fact that survivorship care crosses healthcare sectors and it is fairly resource intensive. And so we need collaborative research. Enable health professionals and decision makers to be involved in, again, the design of funding calls to make sure that relevant and responsive research is funded. And the third one here is to develop and evaluate and implement really an evaluation framework to assess return on investment and to, I think, which is very important, to promote successes in cancer survivorship research. And the fourth is to build and maintain infrastructure and expertise to advance research. So coordinate efforts to develop research tools and platforms that build on, again, and leverage existing strengths in Canada. So one example that was brought up over and over, for example, from our consultation was to develop sort of a comprehensive to leverage, data, our expertise in databases and registries and so on, to be able to develop a comprehensive national longitudinal database to monitor survivors' outcomes. The second here is develop and sustain emphasis and expertise in cancer survivorship research. So a focus on developing expertise, but maintaining that expertise focused on cancer survivorship research. So lots of, that could take many forms, but things like training and early career investigator awards, research chairs, team-based awards, and so on. Okay, so back to this picture. So I'm gonna go through for the next 15 minutes or so, and then we'll have time for questions. The framework itself, the 3 research domains, and the 4 cross-cutting themes. And again, hit on the priorities of both. or of each of those. So the research domains are sort of in the middle here, but they're survivors, experiences and outcomes, late and long-term effects, and models of care. And these just outline sort of broad research areas, and again, with a number of priorities within each. So I'm going to talk about survivors, experiences, and outcomes first. So the priorities here. So, the first priority, and this was loud and clear in all of our consultations, and I suppose might feel like a little bit of a no-brainer, but is to conduct research that targets the real needs of survivors and that evaluates survivor-relevant outcomes. And so our research needs to tackle, the things that survivors need and what it is they want to get out of survivorship care, what it is they need during that time period and what's important to them. The second is to investigate the functional and economic impacts and outcomes of cancer and its treatment. So survivors in particular indicated this as I would say they placed a very high degree of priority on this in particular, and certainly around things like the financial burden of cancer and return to work, and those are prime concerns. And interestingly, when we looked at the data between sort of the survey with survivors and the survey with the professionals, survivors certainly placed a higher degree of sort of priority on these issues than professionals. The next is investigate the informational and self-management needs of survivors, particularly with specific focus on managing comorbidities and on navigating the healthcare system after treatment. I'm sure it's not surprising to anyone who's listening, on the webinar here today, but basically the survivors that we spoke with and that we consulted reported very high informational needs post-primary treatment. And of course, this ranged everything from the, information around risk of recurrence and second cancers, prevention and management of comorbidities again, evidence-based surveillance practices, right? Late and long-term effects of treatment. I mean, everything, the high informational needs. And in effect, there was a really strong message or perception that clear, consistent, trusted, timely information is absolutely essential to optimize survivors' experiences and outcomes. The next is design and test interventions to address psychosocial needs with specific focus on fear of recurrence and transition back into daily life. And lifestyle interventions were seen as particularly important to survivors, and as they also provide sort of a sense of empowerment and doing something about their health. There was pointed out that there's a real need to design and test innovative ways to provide social support. So this might be creating new kinds, I guess, or sort of forms of supports and services, but also sort of innovative modes of delivery to make sure that that they reach people when people need them. The other thing I'll point out here around interventions, particularly to address psychosocial and informational needs, is that it was, those interventions don't have to begin, obviously, when treatment ends, right? Those interventions can begin before the end of treatment and still, and obviously have a huge impact on psychosocial functioning post-treatment. So the next thing I'll talk about are late and long-term effects. So there was, a huge sort of emphasis on really the need to better understand and the need to generate evidence on the types, prevalence, development, and trajectories of late and long-term effects, and to investigate and understand mechanisms of late and long-term effects and predictors of high risk. So in the absence of sort of this important evidence, it was recognized we can't provide right now sort of evidence-based recommendations for many, many important facets of survivorship care. Many of our survey respondents and key informants really sort of are really concerned with, major morbidity, things related to major organ dysfunction, for example, like cardiac and lung problems, and second cancers. And so really felt that researchers needed to figure out who is at higher risk for developing these major late effects, and then what can be done to sort of identify them and manage them as they emerge. So identify them early and manage them as they emerge. Investigate informational needs regarding late and long-term effects. Develop surveillance mechanisms, again, to identify late effects and their impacts. And design and test interventions, both lifestyle and medical, to prevent and sort of manage the medical and psychosocial late effects that occur. Okay, so the next one I'm going to talk about, I'm just looking at the time here, is models of care. So I would say this domain is a little broader than models of care in the sense that it relates sort of broadly to the organization and delivery of cancer survivorship care. So it includes things like transitions in care, care settings, communication, and so on. Certainly, one of the priorities here is to generate evidence to permit risk-adapted long-term follow-up care, particularly for sort of understudied cancer sites. So, recognize that this evidence then would move us away from sort of a one-size-fits-all model of care to one that's informed by an individual's own needs, right? And that includes the sort of possible or probable consequences of their cancer and treatment. Generate evidence to permit the identification of evidence-based surveillance practices, as well as the identification of ineffective or low-value tests and interventions or investigations. And, it was many folks that we consulted really raised concerns about appropriate surveillance practices. So what do they need? What needs to be done? When do they need to be done? By whom? And so on. And that there's not a lot of evidence for many cancer types right now around that, but also a big concern around, what doesn't need to be, like understanding what we don't need, right? And what's ineffective and what's low value. Design and test interventions to improve coordination and integration of follow-up care. And finally, again, there was recognition, wide, I would say, recognition amongst many of the people we consulted that there is evidence out there now around high-quality evidence around some of these things, right? Around models of care and so on, but it's not being put into practice. So there's a clear problem with finding sort of successful ways to implement that evidence in the real world. And so a desire to do more implementation science so we can figure out how to more rapidly move findings into practice. So 4 cross-cutting themes. The first is engagement of survivors. Number 1 was ensure that survivors are engaged in both research and decision-making processes, so survivors and their family, friend, caregivers. The next is leverage survivors' voices to increase attention to and funding for cancer survivorship research. The next is gather perspectives and experiences from a broad range of survivors. So there were concerns that came up in our work that typically the engagement of survivors, or when survivors are engaged, that usually involves atypical representatives. And that the survivors who are involved in research, on research teams now and things like that, may not bring sort of a fully representative range of viewpoints to that process. And so, really, for example, survivors involved in research may be more likely to resemble researchers, right, than others, and in terms of their education, income, where they live, and so on. So a real need to gather sort of experiences and perspectives and to include people from a broad, broad spectrum. Design improved strategies and mechanisms for healthcare providers to communicate reliable information to survivors. informational needs, again, were very high, and part of this as well is understanding how to communicate information to survivors and their care providers years after. So new information that we learned, for example, about late effects of treatment, and how do we communicate that to survivors, you know, a decade later or longer, you know, post-treatment. Special populations. So really one priority here is, and that is to fund research, specifically sort of fund research and to develop targeted funding calls to study understudied populations. And I would say some of them that came up and that are included in the framework I've listed right here, but this is not an exhaustive list clearly. But they are groups that were brought up by many of the people that we consulted with. And that's outlined in the framework. I will note that the bottom one there, sort of survivors with metastatic disease. So it was highlighted throughout the information, the consultations we did, that survivors with metastatic disease often feel very marginalized by the healthcare system, yet, you know, probably need more, not less support than others. The next is knowledge to practice. So again, prioritize knowledge translation where appropriate. So it was recognized, obviously, that it's not always appropriate. I mean, if we're doing some basic science and so on, it may not be appropriate to have knowledge translation as the priority there. But essentially, when appropriate, we need to make sure that findings are communicated and are delivered in understandable and relevant ways to our stakeholders. There was, you know, the next there, is encourage collaboration across the research community and with external stakeholders so that we can create interdisciplinary teams that include researchers, decision makers, healthcare professionals, and survivors. So again, that sort of notion of integrated knowledge translation. And then provide funding and opportunities. So again, think about the target audience being sort of largely funders or provincial cancer agencies and so on. The recommendation is that they provide funding and opportunities for researchers to be able to share and translate their research into practice and policy. There was a lot of barriers. There was a broad recognition, I would say, that many barriers exist to sort of moving research findings into practice, programs, and policy. And one of them, actually, that did come up again and again was the perception that there may be a lack of awareness on the part of decision makers, for example, in regard to the very sort of real and substantial needs of some cancer survivors. So sort of just a lack of awareness that, you know, even though people are post-treatment and they may be several years out or longer, there still can be sort of very real and substantive needs that they have. Finally, capacity building. So the first priority here was build capacity in and increase support for trainees and new investigators. The next is increase capacity in intervention research. And this includes cross-jurisdictional research that supports or enables access to large and diverse populations. And so the sense, sort of there is common sort of agreement, I guess, if I can say it like that, that we need to build capacity in cross-jurisdictional intervention studies that, you know, so they're not just done in one institute and they're not just done on a pilot scale. They need to be much more larger than that to be sort of very robust research, but also then to inform practice. Leverage and build on existing resources, data sets, and researchers. So I had talked about that. And develop tools and platforms relevant specifically to cancer survivorship research. And so, you know, for one example of that there was recognition that there's certainly growing expertise here in Canada around patient-reported outcomes, so patient-reported instruments, tools, and outcomes, and leveraging that expertise to develop survivor-specific tools and instruments would advance research in this area. All right, so key principles. Overwhelmingly, throughout all of our work, and especially when we were with our work with the CCRA working group and the expert panel and advisory group, but also with the key informant interviews and so on, it was very clear that future research must have these four things, really, or we need to think about these four things when we're funding future research. The research has to be responsive to survivors and health system needs, has to build on existing strengths. We have to avoid duplication, and it has to have impact. We have to put opportunities, we have to build capacity and put opportunities in place so that the research findings are actually, brought to the point where they actually benefit patients, their survivors, and their families, as well as the healthcare system. Okay, so I put this up here. These are all of the member organizations, again, of the CCRA, and so I'd like to thank these organizations. Last year, it was a 9-month process, and I think we worked well together. Oh, it went really quickly. We worked really well together, and I'd like to thank them for their leadership. The one thing I'll say is that right now those organizations are going through a process. So the CCRA is going through a process where they are creating a plan for addressing those recommendations. And so that's the work that's going on right now. I will stop there, and hopefully I didn't go too long.